people have been brainwashed.
Mm-hmm.
They've been brainwashed,
Yes.
and so they've been conditioned to just, automatically push back, on anything that somebody else calls, quote, socialism, unquote, for not realizing that Medicare also fits into that definition. Medicaid fits into that definition. Heck, Social Security fits into that definition. TRICARE for the military fits into that definition.
Alrighty, welcome in to your favorite political podcast. It's Alabama Politics This Week with Josh Moon and
David Person.
How are you, Dave?
Man, I'm feeling good, man. We're moving towards the holidays and lots of exciting things in the world of Alabama politics, right?
Yeah, man. We just before we came on, Dave was especially happy because he got to play his favorite role, which is bouncer. Got to bounce somebody just right the hell out of here.
Let's not characterize it that way.
No, he was not. He was not. David was diplomatic. Honestly, that's the best kind of bouncer. It's if you've ever watched Roadhouse, you be nice.
Yeah, that's true.
You
Patrick
walk
Swayze,
them to the door and you be nice. If it takes two of you, you both be nice. It's you're nice until it's time not to be nice. It's and that was a fantastic move. It's hey, before we get going, let me tell you about our friends at Wind Creek Entertainment. I had an opportunity over the last week or so to deal with them. It was a problem. A little snafu came up, and man, they were great. The folks that worked there, they were so nice. They in dealing with problems. The problems all on our end, and they handled everything, and they're great. And in the course of the conversations about stuff, I found out about something, David. And listen, I don't know how you feel about this, but I thought this was something we should have been talking about for a long time.
All right.
Because there is at Wind Creek, Montgomery, coming up, I think it says, let me look it up, but I think it's either this Friday or next Friday. I Love the 90s concert is going to be down there, featuring Vanilla Ice, On Lope, Funky Cole Medina. Yeah, man. That's yeah. I mean, they got a whole show going on down there, man. From what I understand, they've got a lot of. Let me pull this thing up so I can get the actual list of acts.
Ice Baby. Ice
man.
Baby.
Ice Baby going, wax a chump like a candle. That's what I'm talking about. It is they do these things though, and they have these concerts down at Wetumpka and in Montgomery and in Atmore, all the time. And I wish that we could find out a little bit more about them, before they come in and stuff. Because we would have loved Vanilla Ice, Tone Loc, Rob Bass, Young MC. Come on,
Young
man.
MC. Okay, bust the move.
Come on now.
Yeah.
I mean, that's a good time
right there.
Yeah. That's a good time.
Now,
Saturday, December 13th. Saturday, December 13th, 7
that's
o'clock.
coming up. That's coming up.
Yeah, Wind Creek, Montgomery, man. I'm telling you.
Okay.
The folks need to get over and see it. Look it up online. There's still tickets available. I'm looking at them right now. Got book a stay over there if you can. Last I heard, they were sold out of rooms though at the place. You know what? If you can't stay there, stay in Wetumpka.
Stay in Wetumpka,
right across the bridge.
That's
right across the bridge. No big deal at all.
Mm-hmm.
But listen, they're great partners of ours. We really do appreciate them. Y'all get by there, see the concert, and have yourselves a good time.
Nice.
And listen, if you have health care, it may be the last good time you have.
Lord Jesus, yeah, man. Yeah, let me tell you. Yeah, and I want to go ahead and do what I often do, which is to say that column that you wrote, which is what we're going to talk about. Excellent. I mean, it just and people may think that, oh, you're just saying that because that's your boy, your co-host, and, you get a bonus in your check or something. That's not it at all.
Yeah, no. I
As
don't
I've
give out
said,
bonuses. I
yeah,
don't, you know,
I haven't gotten a
yeah.
bonus yet.
Yeah, that's right. Well, listen, I'm like the guy on the Christmas Vacation boss. It's
Yeah.
I'm not. I don't give out bonuses. We
Yeah,
cut out bonuses this year.
but your grinchiness aside, look, man, that was an excellent column, and as I've said before, just to make sure people understand, I was a Josh Moon fan. What 20? Back when I was doing radio, that was about 20 years ago or something like that. And so, I knew going into this whole podcast venture that you could write and that you were an excellent columnist. And the thing that I love is that you continue to hit home runs, man. And you hit a home run with that column. Everybody in the United States, not just in Alabama, but in the United States, could benefit from the way you break that thing down so that people understand what the real benefits of Medicaid expansion and protection of the Affordable Care Act offer versus the direction we're moving in right now. So
Yeah.
great job. Great
Well,
job for
thank
you,
you.
man, by you.
I
Yeah.
appreciate that.
Yeah.
Listen, it just, um, it, especially having gone to Europe recently,
Mhm.
having witnessed the single payer system, having witnessed the folks that rely on it, every day, and talking to them about it, talking about the various options, the various intricacies of that system, and learning, what life is basically like for people who never concern themselves with a healthcare bill. They never concern themselves. It's not a concern. It's not a concern of theirs. It's not something. That's what the people. That was what was so astonishing was, you talk to them about it and they're just bewildered by this concept that we could enter into bankruptcy over healthcare costs. And
Yeah.
it's just like it's like saying you're going to go into bankruptcy because you love sausage. I mean,
Yeah.
it's just like
Yeah.
it's just something completely off the wall. And that they cannot comprehend how we have allowed this to take place. And it's us, and we do it all the time. And what kills me is every single, it's what's in the column, every single day, everybody that bitches and moans and complains about the cost, about the stupid hoops you've got to jump through, about their insurance company rejecting them for a treatment that they need, or rejecting them for a medication that their doctor has prescribed, or they won't cover this, or they won't cover that, or they can't get in to see a doctor, or their doctor dropped them because of X, Y, or Z, or their doctor moved out of state because this state sucks when it comes to healthcare issues. And everybody is complaining about something in this system all the time. But the moment you say, well, you know what we need to do, oh my God, they lose their minds and talk about socialism. And, could it be worse?
Yeah.
Honest to God, could
Yeah.
it be worse?
Yeah, the only people that, I'm gonna tweak a little bit your argument by just saying the only people who probably don't complain are the people who are at an income level where they can afford to pay for the platinum level plans.
Yes.
But the rest of us, which is probably what, 95 to 99% of the country, we have to wrangle with our health insurers. We have to try to navigate copays. We have to deal with, accumulated, medical costs and figure out how do we work out payment plans and that sort of thing so we don't have to file bankruptcy. Or worse, some people end up filing bankruptcy because they just can't do anything else. Or they get dinged so badly on their credit reports, which, by the way, had been addressed by the Biden administration, and now the Trump administration has rolled back, so that, again, the burden and the onus is on those of us who have the least available resources to deal with this whole situation.
Yeah, it's just, it is an absolute atrocity of how to handle this. And it's
Yeah.
getting more expensive every day. Listen, Obamacare
Thanks, Trump.
is Well, yeah, right. And
Yeah, thanks,
Obamacare
Trump.
is no is yeah, I struggle with how to characterize Obamacare because nuance is so lost on everybody now. So you can't
Mhm.
criticize it because the moment you criticize it, it's everybody's like, oh yeah, see, finally you've come. Look, the system that we had before, costs were increasing at such a rate. Insurance companies were routinely dropping people who had been paying faithfully into those companies for coverage whenever they got sick and they were having bills rolling in, and all of a sudden the insurance companies would drop them. You could not afford basic care in a lot of the programs that were out there that were being offered. So the Obamacare addressed a number of those issues. Obama didn't want that. Obama wanted a single payer system. That's the way this thing started. He couldn't get it through because he didn't have the votes in the Senate to make sure that happened because of a whole string of events that happened with various people not being seated in time, or the election, or the challenge, and then somebody dying, and then so they never could get um, this single payer system, through. And so he pivoted to Obamacare because Obamacare was a GOP backed program. It was Romney Care basically in Massachusetts at the time.
Yeah,
And, and this is what they were doing. And so it was, I believe it was the Heritage Foundation or one of
I
those
think so. Yeah, I think it
that,
was the
that came
Heritage
up with this
Foundation. Yeah.
program. Of course, Republicans didn't back it because it was a change, and so now they can just lob bombs from the outside. But they also didn't challenge it as much as they had challenged some of the other stuff, and so it made it through. And it has slowed. It has slowed, believe it or not, it has slowed the increase of costs on average. We've saved some $700 billion already from having Obamacare since 2010 or 2012, whenever it was fully implemented. And it'll save more over the next few years, but the costs are still increasing. And unless we do something to get that under control, we're going to price a lot of people out of this. And it, we've got to do something. And the
Yeah.
only way we're going to be able to do it is a single payer system.
Yeah. And the thing, and you're right to, I think, characterize Obamacare as sort of the lesser of evils. I mean, you didn't use that term or that phrase. I'm using it. It's the lesser of evils. It was not as good as what we could have had and should have, but it's certainly better than what we did have. And of course, one of the drawbacks with Obamacare was there's some people who really, because of the income level they were at, couldn't really take advantage of Obamacare.
Right.
So Obamacare helps, millions of Americans. I think some 20 to 25 million or something like that. But there are others of us who really weren't able to to benefit from it, who also could use the help in some way or another to get healthcare costs down and to be able to get quality healthcare packages.
Mm-hmm.
I have a package that I would call sort of mediocre. I'm a small business person,
Right.
so what I'm paying is just for a sort of a middling kind of package. In order to get the kind of package that I really would like to have and that I used to have when I was on the payroll of a major media company, I'd
Uh-huh.
have to pay more than double what I'm paying now, probably
Right.
triple what I'm paying now.
Yeah.
And as a small business person, I can't afford to do that. So
Yeah.
I think there are a lot of people that are in my situation. And then, of course, there are people that are in much tougher situations
Well,
who
yeah.
have been affected by this crazy, just impotent, and I use that word intentionally, impotent healthcare system that we've
Yeah,
got.
it's crazy. What's really crazy about the whole thing is if you look at it, you mentioned the rich folks who can afford, the kind of the Cadillac healthcare program, health plans, and they don't concern themselves with it. The moment those people are eligible, almost every single one of them opt for Medicare. Every single one of them. They go through the Medicare system and they pay for that. It is a system that works. It works. It's socialized medicine.
Yeah,
We're
it's
all
it's a
paying for
single
it.
Single
Yeah.
payer system,
Yeah,
basically.
it's I mean,
Yeah.
and it works. There are nuances within that system as well. There are options for things for you to purchase if you have more money, but there's basic coverage there for you to go and get things. Is it expensive? Yes, but on the whole, it's less expensive than what we're paying. And the reason why that is because the government negotiates the contracts, and the pharmaceutical companies, the hospitals, the doctors' offices. In most cases, it's the reason why Medicaid expansion is such a big deal right now, is because they know they're guaranteed to get a certain level of payment out of the government over these things, where they're not going to have to chase it. They're not going to have to go after somebody. Somebody's not going to have, walk out on a bill or declare bankruptcy and not pay the bill. They know it's coming in. That's why that is such a big deal to a lot of rural communities, because in those rural communities, those hospitals that are closing down there, they're not getting the payments from folks who they're serving, because they fall in that gap a lot of times, and they're either declaring bankruptcy or just not paying the bill. And so they're losing money, hand over fist all the time. And so that it just, I just don't understand. It's always been so confusing to me what you're fighting for. What you're fighting. I mean, I know what the politicians are fighting for. I know they're fighting for the campaign donations that they're getting from the pharmaceutical folks and from the hospital associations and from the big corporate conglomerates out there that are making money left and right and paying CEOs millions and millions of dollars every year. I mean, look at some of the look at these hospitals, some of these places that are going bankrupt. Look at what they're paying the CEOs of these hospitals. The nonprofit hospitals out there. I mean, it's atrocious what's taking place. And then on top of that, there was a book a few years ago, and I want to say it was called A Bitter Pill or something along those lines. And it broke down kind of how billing works with hospitals and insurance companies, and with the charge master list of charges and things. It's nuts, man. It is insanity what the hospitals charge insurance companies versus what you could get the same service for if you walk in without insurance. I mean, it's just there's no rhyme or reason. No one can tell you why that is. Why it's this way.
Yeah.
It's
Yeah.
nuts.
Yeah. I think I saw something similar, a report that was done as a series of media reports, I think.
Yeah, I
And
think they took from
basically,
that book. I want to say maybe it was Time magazine that did that, and the author from
yeah,
the
yeah,
book.
yeah, 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 yeah. And
Yeah,
the guy was who wrote it. Man, his name is right on the edge of my
yeah,
brain. He was a guy who had done Brill. That was
yeah.
his
I
name.
think that's
I think
right.
his name
Yeah,
was Stephen Brill. He did some remarkably meticulous reporting to address or to cover just what you talked about, the overbilling of simple things. It may have been something like a box of Band-Aids that
yeah,
you could walk into CVS and pay $5 for, or something like that, or $7 for. Instead, hospitals were being billed like $25 or $30 for it, something
yeah.
crazy like that. So yeah, you're right. I mean, that is really in part what has what drove up or helped to drive up the cost.
Mm-hmm.
It's just criminal, man. And I think, again, to go back to your column, what has happened is Alabamians and people across America have been, and I'm going to use the word you used because I think you're right. Some are going to say, well, that's harsh or that's callous, but I think you're right. People have been brainwashed.
Mm-hmm.
They've been brainwashed,
Yes.
and so they've been conditioned to just, automatically push back, on anything that somebody else calls, quote, socialism,
Mm-hmm.
unquote, for not realizing that Medicare also fits into that definition. Medicaid fits into that definition. Heck, Social Security fits into that
Yeah.
definition.
Yeah.
TRICARE for the military fits into that definition.
Yes, it does. Yeah, man. You're 100% right, and you're right. Yeah, people have been conditioned against against socialism, against just the word socialism. You know, they've been conditioned against it to think of it as this awful, awful thing, and they, you know, and they don't recognize, I think, kind of again, I've used the word nuance a couple of different times, but the nuance that's involved with socialism when we're talking about it, and where it's being applied and how it's being applied. But you're absolutely right, and it just we use it. There's a story this week about Trump wanting to give farmers $12 billion in handouts to make up for his stupid tariffs.
Yep.
That
Socialism.
That's socialism. You
Yep.
know, I mean, it seems as though we're perfectly fine with socialism as long as it benefits us.
Mhm.
You know, certain people, that is, certain people.
Mhm.
You know, it's fine for the socialism at that point, but not if it benefits the really poor people. You know,
Yeah.
then it's atrocious. It's atrocious when we shouldn't be doing it, and these folks are just going to keep coming back for handouts all the time. And you know, and when what we actually know is if what I wish we could present it, and I wish there was a way that folks could present it, and where we just said, look, what we're doing is we're creating a group to buy insurance here. Okay, we're creating a group plan of every person in America, and we're all going to buy the same plan, and the same plan is going to cover this. And here are some other options that you can have if you want to put more in. You know, and you can buy a private plan if you would like to, and that private plan is going to cover X, Y, and Z and get you to this. But here's the base level that you can have. And by the way, you're going to pay more in taxes. We're going to take a little bit less. We're going to kill some of these deductions, and we're going to tax some of these corporations and some of these billionaires a little bit more. And, you know, Bernie Sanders, by the way, has been pushing this for his entire life. And as I've told people before, listen to Bernie if you're a working person, and then come back and give me the highlights on where you disagree with him. Okay. Tell me what he says that wouldn't better help your life. And then you tell me why you don't want it, other than you've been conditioned to say that what he's talking about is evil socialism, and you don't want it because he's a lib. You know, that's it. That's the only thing that you can say about it. And I just, we've got to do something. People are literally dying.
Yep.
They're dying. So, all righty. Speaking of dying, we go from one atrocious story to another. But we're going to be happy to have the person in here to talk about it, because Beth Shelburne, our old friend, is going to come in and talk about what's going on with the Alabama Solution, her role in that, and the film on HBO. And it is great in a very depressing way. And but we're going to talk to Beth on the other side. We'll be back in a minute. It's Alabama Politics This Week, brought to you by Wind Creek Entertainment.